It's both.
Yeah,
It's
he's
very early for both of you, so thank you so much.
yeah.
All right, cool. So hello everyone. So welcome to today's APAC community call. So for today, well, first, of course, go through the OHDSI news, which we do have a big announcement for you about OHDSI APAC registration. And then for our second section, which we kind of started to last time, we will also share the newest and greatest OHDSI studies that's our calling for participation. So for anyone who are interested. And last but not least, which is really our main focus today, we are very, it's such a pleasure that we have invited Pantelis from Greece and Guy from Israel to share their chapter stories and experiences of adopting OHDSI, adopting OMAP CDM in their country. So which will be really nice for us to hear and learn. So first of all, about OHDSI news, we are very glad to announce to everyone here that our APAC Symposium registration page are out. So if you go to ohdsi.org and then you can see at the third row of the tab, so you see there is a direct link to 2022 APAC Symposium, which you can see, because we have Taipei Medical University hosting. So and very looking forward to that. And then we see, there are different actually separate registrations for day one, which is a tutorial workshop. And then there is another which is really the main course, the main conference day, which is the day 2 here. And as you can see, we do have a full pack day for you. And then later on, you can see kind of for all of the registration information together with the detailed agenda. But I do want to bring to everyone's attention, which is also the words, the paragraph that Stone was sharing earlier in red. So really due to the awesome, I can't believe we're still talking about COVID after 3 years, but due to the uncertainty of COVID traveling and quarantine restrictions, so we will be making a go, no go on the in-person conference. Due to the travel registration locally in Taiwan. And then we will, so basically all of the registration now are for virtual only. And if we decide to go with in person, we'll then be sending out, we'll be updating this page as well as the registration information for that. So please stay tuned. So that's and also, of course, we have a APAC collaboration showcase. So all of the requirement or like the templates should be very familiar to everyone because it's the same as our global symposium. So that is for the news. So feel free to sign up for the OHDSI APAC Symposium and let us know if you have any questions with, logistic registration or any other questions. The second I want to really share, which is also kind of a bit similar to what we'll be talking about today. So we're very happy to announce there is a new study from the community, actually Israeli OHDSI Community Care Research Institute about IBD. I'm not going to say the full word of the disease, a very autoimmune disease. And then the study is around the characterization for the disease. And and we can see there are the objectives, and also you can see there are different study sources, one being the study overview by Chen, who is the study owner, and also the study repository with more detailed information and documents. So feel free to review them, and please reach out to Chen if you're interested in joining either as a contributor for the analysis, writing the protocol, writing the paper, or joining as a data partner. Cool. So
Jing, Pantelis, you didn't share your slides in advance. Would you like to share your screen for the presentation?
Yes, so I was going to say thank you. So without further ado, so we'll first have Pantelis from Greece to share about OHDSI Greece with us. So if you'd like to share your screen.
Yes, of course.
All right, thank you.
Thank you very much for inviting me. It's a very good opportunity for us to share experiences and gain from your experience, as Greece is a relatively new place for OHDSI. Ironically, since all the names in the OHDSI initiative, typical names in the OHDSI initiative come from Greek mythology, still the OHDSI initiative is not really developed in the Greek ecosystem. So my name, first of all, is Pantelis Natsiavas. I come from the Institute of Applied Biosciences at the Center for Research and Technology Hellas, which is located in Thessaloniki, in northern Greece. Thessaloniki is the second biggest city in Greece, with a population of about 1 million for the wider region of Thessaloniki. So, as I have already told you, we are this small dot here in the global map of OHDSI. We are a research institute and we follow OHDSI activities since about 2016, when I finished my master's, back then with Dr. Vasilis Koutkias. My lab is an e-health lab, which has been appointed as the national node for Greece in last November. So we are a relatively new national node, and this is. And I'm going to give you my experience in terms of struggling to attract data providers and companies which might be interested in participating in the OHDSI network in any way. The idea is that back at last summer there were only two organizations working with OHDSI. Now we have 2 data partners and 2 SMEs, and there are at least 6 data partners who are trying to join in the OHDSI ecosystem using the funding process provided by the Eden project. And there are also 3 SMEs which are currently certified using also the same Eden project processes. Eden, for the ones that might not know it, is the European project built to support the building of the OHDSI ecosystem in Europe. It's a project led by Erasmus University, and more specifically, the coordinator is Professor Peter Reinbeck. So this is the map of Greece. The reason that I show the map is because Greece's geography has a peculiarity. Greece has a lot of islands, and its landscape is a little weird. So Greece is a country with many hospitals, too many hospitals, I guess, for a country of 11 million, with a population of 11 million. Greece has about 140 hospitals. So this is a peculiarity because this means that Greece has very few, very big hospitals and a lot of small hospitals. So this means that a lot of these hospitals don't really have the resources of having IT staff and people who might be involved in such an initiative. They don't have the capacity to provide or analyze data and so on. So even if they do have information systems installed, which is not always the case, it should be like half and half. Half of the hospitals should have full electronic healthcare record systems installed. Perhaps half of them don't have a full electronic healthcare record system. So even the ones which do have electronic healthcare record systems, they don't necessarily have the capacity to support such an initiative. So there are two ways to see things based on my experience in the Greek national node. You can see the challenges. You can see the glass half empty. There is indeed a big lack of IT systems, which is something that currently the Greek government has plans on how it should be tackled on a national level, of course. There is a lack of mentality since Greek hospitals really don't focus on conducting research, or they don't have that big clinical trials, at least not the majority of the hospitals. And there is indeed also a lack of central guidance in terms of national policy. However, if somebody wants to see the glass half full, I have to admit that when we started working on that about 1 year ago, when we were assigned as national nodes, there were only 2 organizations in Eden or the OHDSI ecosystem from Greece. Now we have 10 organizations on board, and this could be considered a progress if somebody wants to be an optimist. So the idea is that things could work, but we are not really where we would like to be yet. What we can do as an institute is to focus on communication, to be really consistent and really diligent on that. We look on each one of these hospitals, the person that we should communicate with. Sometimes it could be the president of the hospital. Sometimes it should be the IT guy. Sometimes it could be a medical doctor, a researcher, or somebody who would understand and who could push things forward. We take this one step at a time, and we focus on that a lot. Moreover, we also organize events to communicate the idea of using real-world data and conducting observational studies in collaboration with universities and so on. We try to engage national organizations like the Association of Pharma Industries and so on. And we also intend to plan to conduct a half-day webinar just after the last call for data partners from Eden is going to be completed, which is planned for the middle of October. This is more or less our communication plan, which is the first priority for now. After that, I hope that next year we will start working on a pilot study for using Greek data. This will be also a critical step. I hope that next year we might have a critical mass of data providers. I know that, for example, now the biggest public hospital in Thessaloniki has joined the Eden initiative. They have been acknowledged. They have taken the grant, and they started working on converting their data. And this is the biggest hospital in northern Greece. So we hope that next year, sometime next year, we will have the critical mass of data providers ready, so that we could start planning on a study based on Greek data, and we could start really activate the network and start discussing and planning things. Another key issue in terms of funding, because this is always an issue, or we don't yet have any kind of funding to support the national node. The only funding comes from Eden, and it goes directly to the data providers, of course. So we plan to apply for national research funds to support this network of observational studies. So this is more or less what I had to present. I would be happy to hear from your experiences, comments, advices, whatever. Thank you very much. And also, I would be happy to share my slides. Sorry, I missed about the email.
No problem.
No problem. I was just wondering, like, for so you mentioned like 2 data nodes. Are they different hospital? Sorry, I forgot which slide.
We have in the Eden project, there are 2 kinds of entities identified. One of them is data providers, typically hospitals or organizations who actually host data. And the other kind of entity is an SME, a small to medium enterprise, namely companies, which would be like IT companies or companies which build electronic healthcare record systems, and they would, and SMEs would typically help data providers to convert their data, because data providers like hospitals don't necessarily have the technical capacity to do this, to apply this ETL process. So this is something that SMEs could really help with. And there are 2 kinds of entities. So currently, we have managed to, we have only 2 data providers and 2 SMEs fully certified in Greece. But now we have another 3 SMEs being certified as we speak. All 3 SMEs are going to get certified in September. Actually, in 10 days, in 20th of September, it's the the certification process. And we also have 3 data providers who got the grants from the Eden Academy and from the Eden project, and they are now starting the phase of converting their data, which will take some time, of course. So I hope that sometime next year we will be in the phase of planning a Greek
studies.
study. Yeah. The first Greek study. This is what I have as a milestone to do at least 1 study to get all things straight and understand what kind of data everybody has and what we could do with them.
It's always hard for the first one.
Yes, I guess. But we are not there yet. We hope that we will be there tomorrow. I would be happy to hear any kind of advice or comments.
Cool, thank you. Any questions or comments from the audience?
Yeah, Pantelis, hi, Song here from IQVIA. I actually have a question on your action plan about getting national funds, right? So right now you mentioned that all the money is coming from Eden, which is going to the data providers. So I'm just trying to understand, so other than the data providers, who else, so which other stakeholders are you looking to, do you think that is eligible for some financial support from the government, right? So are you talking about the SMEs, or like, I'm just wondering what other stakeholders that you think are required to be incentivized?
Yes, thank you. SMEs would typically act as subcontractors on behalf of the hospitals. So even now that Eden funds the data providers, sometimes SMEs act as subcontractors and get some money to do the conversion or to help with the conversion process, with the ETL process. So this is typically the way an SME would be involved.
Right.
It's crucial because in Greece, at least, there are 10 SMEs which have built the electronic healthcare records for all the hospitals. So since the hospitals don't really have the capacity to do data processing, you need to have an SME on board. So it's crucial to incentivize a company, because otherwise they will not care, of course. So this has to do with SMEs. Data providers, which are the hospitals, when I'm talking to them about money, I'm telling them is that they should not really care for getting the money from the Eden project, because these money are not really that big anyway. So,
Okay.
and they have a very specific focus. The idea for them is to open a new door and a new perspective in terms of functioning, and perhaps being able then to attract clinical research or get in contact with big pharmas who would be interested in Eden, and implicitly know about the hospital and the data they host, and so they could start a new cooperation, either database or in terms of clinical practice. So this has to do with data providers per se. I also think that if you want to set up observational studies or to take advantage of this data, there is also the need to engage biostatisticians and researchers.
Correct.
So, in my view, the best way to do this, and this is actually my part. We are a research institute, and currently we don't get any funding to do that. But we think that there is a lot of room to do work on that aspect, to do work in terms of methodological issues, in terms of how this data should be analyzed, in terms of statisticians or in terms of engineers. I am an engineer by background, so, and I think that there's a lot of room to build tools upon this data modalities and so on. So I think that this is the third node, which is currently in Greece not really a big part of the ecosystem. But I hope that next year we will be able to apply for some funding and get also the interest from researchers.
Right. So Pantelis, I think I can share some experience from Korea, right? Also, Korea also had a project similar to Eden several years ago. So first, the project started with government funding to get data providers to get their data into OMAP. But after that, there were a series of government research projects also coming up. So researchers would apply to the government that they want funding to do studies using OMAP. So I guess even in Greece, right, this stakeholder, the research community can build on other experiences from other countries to get funding from the government. But yeah, it's just a example of how the Korean OMAP, the OHDSI community is leveraging the OMAP resources and along with the government funding. So yeah, maybe some a reference for you when you plan out next steps for the Greece community.
Thank you. It makes sense. I mean, thank you.
Yeah, all for me. Thank you.
Okay, cool. Thank you, Pantelis. And we will be, of course, sharing the recordings and the deck with everyone for reference as well. Cool. So next we'll have Guy from Israel to share the OHDSI Israel chapter. So Guy, would you like to share screen?
If you like, I can share my screen, Guy.
Yeah,
whatever
you can share your screen.
Okay, awesome.
Okay, cool.
But I will make you work during the presentation to switch the slides.
No problem. My pleasure.
Yeah, so thank you for having me. My name is Guy Livne. I'm the the health informatics consultant for the Ministry of Health in Israel, and leading all the OMAP and the translation to the hospital data to OMAP. This presentation, the basic is what I present in the OHDSI Europe symposium last June with a special update for Europe, obviously. And I start with exactly our journey. Next slide. Next song. Thanks. So a bit of geography. In Israel, as you probably know, is a small country. And we have only one lake that we are really proud of. It's called the Sea of Galilee. And Sea of Galilee has 7 streams that facilitate this lake. And we call our project Kinneret on this lake with 11 hospitals that will facilitate the data to this central OMAP data lake. Israel is a diversity population. There is a different city population and the rural area, and the data that we have is all ages, different lifestyles. There's Jews, Muslims, Christians, and whatever from Israel is people that came from all over the world. So there's diversity in population. Next. So we start our journey. We have each hospital has its own data, its own EHR, isolated EHR system, and our mission is to actually gather all to one lake in OMAP. But no medical center has actually volunteered to give us the data, and it took a lot of time to convince and to show them the value of translate it and be one project. So when we start moving, next. I told you you have a lot of work doing this presentation song. Yeah, so when we start moving, we start to extract the data and incur the first big nut to crack, because there was the first time that to actually upload health data to the cloud in Israel. And there was no regulation in place. There was no guidelines. So we need actually to write down the guidelines and eventually to go to follow them by encryption of the data and do some anonymization modeling in order to upload the data to the cloud. Next. After managing to crack the first nut, so the second nut was even bigger, and it was translating the data in Israeli hospital, which is something in Hebrew, some is a local domestic codes, and also differences between the hospitals. We are in Israelis, and Israelis, you probably know, I like to invent things and to be unique. So each hospital has different codes, sometimes different codes for the same disease. Sometimes in a hospital, there's different departments, and each professor decides on the code that you want to write down for special disease. So we actually need to gather all and put it into everything into OHDSI standards. Next. That we did this by NLP and some similarity text modeling in order to translate everything as much as we can, and this solves us about 85% of the translation. And the rest, 15%, we actually done manually by the medical doctor, physicians, using USAGI. Next. So after about 2 years of work, we managed to upload the first hospital into our data lake with 1 million patient records and full age record. Next. The second and the third would actually go for the same track, so they were a lot easier. And when presenting in June, we had 3 hospitals, 4 million patients on board. And the important thing is it is all is unified person ID. So if one person would visit those 3 hospitals in different years and different periods of life, So we will be able to track record of all the visits, actually collect all the data and have it as a one record and one trail record of a patient, and that's why we can have the lifestyle or the life history of a patient. And next. And now we already have 4 hospitals on board and 5 million patients. And, yeah, next. So what we have accomplished until now, so we have 4 connected CDMs with full EHR data. So we upload all the procedures, the visits, the drugs, the lab tests, everything that's actually recorded at the hospital is uploaded and mapped to OHDSI standards. And we also have non-OHDSI data in this, and I forgot to update, it's not 12 million visits, we already have about 30 million visits with 50 years of patient history. Next. About the CDM with Atlas for statistical studies and done a lot of work at the hospital to get the physician themselves to work with the tool and conduct a research. I must say that we were pessimistic at the beginning of the using it, but it's working and it's working great. And we already start to conduct some study, which I will show later on the presentation. Next. But statistical studies is sometimes not enough. Sometimes we want to do some modeling. We want to run some R script. We want to create some predictive modeling. And for this, we establish another place with a workbench for study, where we can extract the data set for the study from the OMAP, upload it to a different area, and provide just open, it's a cloud-based open research, secured for modeling and for that can have Python, R, and additional statistical tools, so they can run some modeling and some more advanced statistical that aren't available to do in the Atlas or the HDSI, which is a bit more complicated for them, and sometimes they want just especially companies or startups or pharma companies that want to use the data, so they would like a different workbench where we upload the data set specifically for them. We also upload to the same area and some unstructured data that actually we call it non-OMAP data, like imaging, like monitor data, and other stuff that doesn't have a place to put in an OMAP. So we upload it to the same workbench for the study and connect it to OMAP through patient person ID and visit ID. So they have the demographic and all the data information from the OMAP combined with unstructured and other non-OMAP data for research. Next. But for ours, that also wasn't enough, because data and study and place to work on the data, this is actually technical part. But we need also to take care of regulation. We need also to provide them with a way to access the data for IRB approval, for some commercial agreement, all the bureaucracy, these things. And I didn't say in the beginning, I am former CEO of a digital health startup, so I was beforehand on the other side of the equation, and I saw how hard it is for an external company to start and conduct research with governmental hospitals. Like with a startup, it took me more than 9 months to start and get the data and start working with it. And maybe it sounds fast, but for startup or for companies that want to conduct a research and move on, you can't wait for this long. So we actually initiate a fast track with a mission for starting study less than 3 months for initial request, and we succeeded and we do it very fast. Next. So not everything is completed. We have a lot of work to do, and we're now conducting additional studies and improve the service, and everything is improving. But I'm proud to say that currently we have actually 3 active studies, and 1 is already completed, which I will present shortly, like a surgery duration. The other 3 studies that currently on running is some study related to coronary artery diseases, obesity paradox, and sleep disorder. 2 of them are internal for internal physician at the hospital that start to conduct the study, and 1 of them is a startup that approach us and start to run the study and its workbench. Next. Surgery duration prediction, that's a study that's already completed. The goal was to help it came from a hospital. They wanted to manage and plan and manage the surgery in a more efficient way. And so what we did, we collect all the information from the medical record and try to run some analytical model to predict the length of an operation in advance in the planning phase. So we were to utilize the operation room in more efficient way, and this study was conducted in a, as I say, it's a predictive study. So we take the data out from the OMAP to a different area, and then we'll conduct the study. Next. So the development site was one of the hospitals developed the study, and we managed to validate it in a different hospital. It was very easy because of the OMAP, because of the structure of the data. It was very easy to actually validate it, and this is the strength of OHDSI. This was the first time that we actually show. So what is multi-site, when we have multi-site data in our data, it's something that was taking about a month, less than a month to validate it, and beforehand it will took a lot more, and probably people that familiar with it will know the difference. Next. So what we're taking out of this study is actually that OMAP was very easy to run a study on, and the work was really efficient. We managed to explain and predict 70% of the variance of surgeries, and Kineret, our data lake, is actually a great platform for multi-center data studies. The study was already published in the MDPI newspaper, And this is a link, so you can go and see where it's located. Next. Next. Yeah, this is, I won't go over this. I can ask for questions, but the way we design the workflow with us is actually starting with a very fast visibility check based on Atlas with our supportive team that can help and create and explain the data to external companies, external research. We have a template for IRB approval and for a commercial agreement. Also, we know to do this in very fast track in less than a month to complete those two bureaucracy stuff and create a specific research workbench where, based on the approval, the company that can get the data set and start the research. Next and last. So thank you. And this pit stop that you see, that's how we try and to work. So we want to be like, we look on us as a data provider. We look on our as a place to conduct as many research as possible, and with internal researchers, with academia, with industry, and we want to be like the supportive team that can help as a pit stop. Can have like, you come with the idea, you get a bunch of people that actually jump on you, get everything in place, arrange everything, and off you go, and as fast as possible. Thank you.
Cool. Thank you so much. Well, you have to like the GIF. Yeah, that's what we're aiming for OMAP. We're just quick and go. Cool. Any questions asked from the audience? I mean, it's impressive that everything was. I think you mentioned 11 months. What was it?
Now we start working on it 3 months ago. No, 3 years ago. Sorry, 3 years ago. Yeah, and actually it was, things were actually ready and waiting for for approval to upload to the cloud, and this took ages. It was, the hard part was actually to convince the government. Like, we're a government, but we're not really like we're in charge of the government or hospital, but there's also the regulatory part of the Ministry of Health, and that was really hard. And when you pass one attorney that say okay, so you go to the next attorney that need to approve it, and then you need to, and then to the third one, and then everyone is asking questions and have to say things, and that was the hardest part or this project. But but now when you first you need to you need to plow the road, but when the road is plowed, so the trail is open, so now everyone is going through the trail. Yeah,
exactly. Cool, thank you. And I do see we have 2 hands raised. So we have Pantelis.
Yes, if we have the time, I would like to take the opportunity and ask Guy 2 questions. I understand that you have a central data infrastructure, right?
Yeah.
Okay.
Yeah.
I am impressed by that, because this would be totally legal in Greece. So I think so. I wouldn't even dare to think of such an architecture. But I wonder if this architectural choice did make your life easier in terms of updates. I mean, do you regularly do updates from the data in hospitals centrally, or is it?
We update the data every quarter with the new data from all the hospitals. We manage we try as much as possible to have one sort of ETL process from all. It's different variety obviously, but try to have one set of code that actually extract data from all the centers into the cloud. And if you have an additional question, like you can get my email, you can have a different call.
Yes,
not in that early time, but we can have a different call.
or perhaps next time we will do it next time in Rotterdam, I guess, physically. Anyway, my second question would be regarding funding. If I understand correctly, you represent the central government here, so you get state funding, right?
We get funding from part of it was the Ministry of Health funding, part of it was the Israel Innovation Authority funding, but now we have a goal from starting 2023 to have the project will fund its own with external companies and research that come and work. So like now we're looking for getting more research from the academia, from the industry, in order to support all the operation that need to be around it. Yeah.
Thank you very much. Impressive indeed.
Very cool. And we also have Roger. Hi, Roger. I think you're muted.
Yeah, I'm muted, and my picture's frozen as well. Hi, Guy. Roger, I'm from Melbourne, Australia. I think did we meet at Rotterdam? Were you in Rotterdam?
Yeah. Maybe I think we met in Rotterdam. I think.
Yeah.
And it took us as I reckon, it took you about 36 hours to come over, something like this.
Yeah, that was me. Yeah.
Yeah. I was impressed with it. Yeah.
Just a question about the unified person ID. Is that something that's mandated in Israel? Has everybody got a unified person ID in their systems?
No. In the separate EHR, there is a different special user ID for each patient. So if you see one person in the 3 hospital have a different person ID at the hospital. But what we did is actually create a new set of IDs based on the person ID. So
okay.
Like the person's social security number. So based on this, like we create our own set of IDs for all. At the hospital, different person have, like same person can have different IDs.
Yeah. Okay. That's interesting. It's the same here. We've got no unified ID, so we do record linkage where we hash different parts of people's identification, like the name and the date of birth, and we hash that and make it into a master ID, we call it. So that's how we do it here. The second question, have you looked at data quality? Because that's something that we're doing at the moment. We're exploring the OMOP data quality dashboard. So have you run that in Israel?
Yeah, sure. And we also one of the hospitals was granted from Eden as well. So we have quite a lot of data quality validation. First was actually, yeah, we run the DQD and make it true. And secondly, Eden have its own additional data quality requirements, so we run and pass them all. And also, we have a contract with IQVIA, and we also pass the IQVIA qualification of data quality. So, like, certified from those 3 areas, and I think we are in a good place.
Ah, that's very interesting. Oh, yeah. Well, thanks, Guy, and thanks for your presentation.
And I must say that, like, it's not so hard but 80% of the queries are the same between those 3 organizations. So it was, yeah, but we managed to pass all of them in a good way, and the data is actually in very high quality.
Excellent, thank you.
Right. So, and I really want to, like, for the last slide, like, we're really looking forward for cooperations and for researchers to get a request from from Stanford, and that I'm working on it, and really try to, in less than a week's time, to do the feasibility check for each request, and to decide of go, no go. We have a team of people that can do it really fast, and looking forward.
Well, thank you so much. Any other? I know we just be conscious of the time. We do have 5 minutes left. Any other questions or comments from the audience? And then, of course, as usual, we'll be uploading the recording of today's call as well as the deck to odyssey.org/APAC. All right, cool. So I guess I'll give everyone 5 minutes. But we do have a question. Soo-jung?
Yeah, hi, I'm Soo-jung from Korea. This is not about the presentation, but I found that the APAC Symposium page, the day 2 is typed as November 14th, and I think, is it typo or?
It's a typo. We are already on it. We don't do the changes. Odyssey Global does it. So yeah, I'm currently working with Odyssey Global to change that. Thank you.
Just wanted to check.
I think they probably calculate, because it's technically, anyway, like, at different time zones and blah, blah, blah. Yes, we will be changing that to Taiwan local time, because it's going to be hosted by Taiwan. So.
Okay, thank you.
All right, thank you. Cool. So we will, so again, feel free to sign up for the APAC Symposium, and we'll be posting today's call to the APAC webpage as well. Thank you so much, and thanks again to Guy and Pantelis to join us this early. Thank you.
Thank you. Bye-bye.
Have a good one. Bye.
Bye. Thank you. Bye.